Okay, I'm Harlan Stone. I was born in Atlanta 5 days after my family took the train from New York to Atlanta, as they did not want another child born in the North. Then I went to public schools for grammar school, high school, but after my first 2 years of high school, I was always in trouble with the school authorities, and all sort of pranks. I never smarted off, but we pulled all sort of pranks, such as having the radio station announce that school was closed because the boiler was malfunctioning and there could be no heat in the school. It wouldn't be repaired until the following Monday, and things like this. And then there were certain people, particularly my sister, who enjoyed tattling on me. And so as a sophomore in high school, I spent almost 3 months in suspension. Well, I never smarted off to a teacher or anything like that, and I had very good grades, and my father kept consoling my mother that they never made a child repeat the year because they failed conduct. But they had heard of strict Catholic schools, and there was a Catholic high school in Atlanta called Marist College. So they sent me there, but all that they had heard as far as discipline was from Jesuit priests, and Mary's fathers were the ones who ran Marist College, and they were nowhere near strict. So I finished there, and they still felt I was too immature to go to college. And although I repeatedly received the class medal for 2 years running as having the highest grades, so they sent me to Episcopal High School in Alexandria, Virginia for another year of high school. I despised it. And then I went to Yale to college, and I met my future wife at the end of my freshman year of college, and she was from Atlanta, and her father was a surgeon at Emory. And so then we became engaged in the middle of my junior year, and were married at the end of my junior year. And I was accepted to medical school after 3 years of college, although I didn't make Phi Beta Kappa as a junior at Yale. And then I went to medical school at Emory, and I graduated at Emory, and then interned at Hopkins. And I was not impressed with the quality of the internship. It was, I thought, atrocious. There was very little teaching. And so then I went into the Army for 2 years. We had our first child born when I was a senior in medical school, second born while I was in the Army at Fort Benning, and the third came shortly after I joined the faculty at Emory. But after my 2 years of service, then I returned to Atlanta, and I finished my surgical training at Grady Hospital, and then joined the faculty. The way things were set up was that faculty members had a responsibility to help supervise the care of Grady Hospital and the teaching at Grady Hospital as well. The first 2 years of medical school were at the Emory campus, and these were the basic sciences, no patient contact. During the junior year, the entire year was spent at Grady Hospital. That volunteer faculty members from town did the teaching of the residents as well as the medical students there. Very little participation from anybody at Emory. Then for senior year in medical school, about a quarter of it was spent at Emory, a quarter of it the VA, and about half of it at Grady again. So that I joined, and I was to supplement the meager Grady salary, which was paid to the department, and the department doled out to a few people, and to supplement it by practicing at Emory Clinic. Others joined, and their income would be supplemented by working at the VA. So that's when I joined the clinic, but because of the huge responsibilities at Grady Hospital, that it was almost impossible to be available at Emory in any way. I ended up being responsible for the 70-bed surgical emergency service. I was the only attending. I set up with that the trauma service at Grady Hospital, which still exists and is pretty well known. I set up the burn unit at Grady Hospital, and I ran it, and that was an extra 30 beds, so it's 100 beds. And then I ran the pediatric surgical service there, which was another 25 to 30 beds. And it was just me. It started off with one other person, but it was just me. And that was about 130 beds. And then there was another ward that primarily did cancer, and there were two people from Emory, members of Emory Clinic, who came, but primarily one was the one who did it. And they had no emergencies at all, but one of them was extraordinarily loyal and very good, and that was Dick Amerson. He was the prince. If you're talking about mentors, he was a great mentor to me. He was just a few years ahead of me. And then the other ward had a lot of vascular disease on it, and so that was covered by people who were part-time at the VA and then part-time at Grady. They did no vascular emergencies, but it was all essentially elective surgery. So that was my introduction into the Emory Clinic, where I was not necessarily available to take consults. I occasionally got consults from other surgeons because it'd be a big bad burn or something else that they didn't know how to handle, a bad case of pancreatitis or some trauma. But so I never did develop much for practice. I didn't have the time to cover. Because in practice out there, that you'd have 5 or 6 patients in the hospital, people would. And I had 130 people down at Grady at the hospital I had to cover. You physically couldn't do it. And I got very little sleep during those years. I then realized I needed to have greater understanding of pediatric surgery. So I took an early sabbatical and went to the Hospital for Sick Children in London, colloquially called Great Ormond Street. And I learned a great deal about doing newborn surgery. And I came back, and that aided me in doing newborn surgery. And then other challenges, like I divided conjoined twins and things like that nobody knew how to do certain things. So, but I was extraordinarily busy, and thankfully there were good surgical residents. And I would delegate authority to them, and I would only know about specifically 10% of the cases that were operated on, but they were the ones that were challenging and difficult, and the surgical residents were very smart in sorting these out, or if they got in trouble in the operating room, they'd call me and I'd instantly drop everything to go down there. Didn't matter what hour or when. And if I was out of town, the only person I could rely on to cover for me was Dick Amerson. He's a prince, as I repeated. And so that was my life. And then there was a thought about Emory pulling out of having to supervise care at Grady Hospital. And if that would have happened, then they would have to cut down the classes size because they didn't have the patient population to support that many medical students. And so I saw that, and I saw also that that was where I was spending all my time, and it was a lot of hard work and busy all constantly, but it was, to me, more meaningful. And so that's when I decided to leave Emory, and I was recruited to go be chief of surgery at the University of Maryland. Now, this is supposed to be about the Emory Clinic, and I know a little bit about its founding in that the Winship Clinic was a main body in participating in the foundation of the Emory Clinic. And Dr. Elliott Scarborough was our leading light, but they had other people there as well, such as Bob Brown and Charles Huguley and Sam Wilkins and the like. Dr. Scarborough was someone who had great leadership. He was a good surgeon, had great leadership ability, and a nice man, capable surgeon. Dr. Brown was a very kindly sort, but he did not enjoy the more challenging types of cases. And Dr. Wilkins did a lot of head and neck surgery, cancer surgery for the head and neck, that not too many people were knowledgeable about that. And then they then had a man come from the Grady residency to join and just primarily did breast surgery, and he was one of the early people in giving mammography a foundation, and that was Waldo Powell. And then there were other divisions of it, such as Charlie Huguley in hematology, all the leukemia and the like, other people. And then added to this were people at a group, I think they called themselves, I may be in there, the private diagnostic clinic, like Spalding, Schroeder, and a few others, and they were joined with it, were early members. As far as surgery was concerned, Bill McGarity, and initially Fred Cooper, but Fred Cooper died at a young age from liver disease. And then my father-in-law, Dr. Martin, but he was against it because he felt that they would become too obsessed and just practice. The idea of the Emory Clinic was that this was a way that faculty could supplement their incomes, and you could provide money areas where there wouldn't be much supplementation for that effort of teaching could be covered. And yet those are critical areas of teaching, particularly Grady Hospital, where more than half of the clinical years were spent. And later on, when the training programs were combined, where more than half the time was spent in postgraduate training. And he felt it was a wonderful idea, but on reflecting, he felt that it might have some shortcomings that would be problems. And so initially he didn't want to join, but he was told that he had to join or he would no longer have his faculty position. So he joined. But he was the one that brought all the residences together in surgery and subsequently in medicine. Well, at one time, you see, there was the Grady program separate. Then there was a program of combination of Emory and the VA, Emory VA program in the various specialties. And then Crawford Long had a separate program. And he brought them all together in surgery, and then subsequently they all came together in medicine, the various specialties. So that he was the doubting Thomas, you might say, of the founding members, yet he was very loyal and supportive in every way. I guess it was when I was in my second or third year of residency at Grady Hospital, and I heard Dr. Martin mention his reservations about it because he was my father-in-law. My wife and I usually had Sunday dinner with him, with our children and that sort of thing. And that was my first knowledge of it. And then when I finished my residency, the Emory Clinic angered a lot of people in town because they had been covering Grady Hospital, doing teaching down there, and they were denied faculty appointments in the medical school. And that angered them, and so they withdrew their support, and they didn't have any reliable people to come down and supervise care there. So I was recruited to go there. And a resident who finished at the Emory VA program, I finished at Grady, and Keith Quarterman, he went down there. Sort of comical. He began with a salary of $2,000 more a year than I was, and my wife challenged her father about how could that be, and he said, I can't show favoritism. She said, no, at least you can make it equal. I got a $2,000 raise. Keith spent about a year or two doing that, and then he became frustrated because he didn't have any supplemental possible source as the Emory Clinic. I didn't get much from the Emory Clinic, but it was a little bit. So he went out into private practice in town. To supplement my meager income, because I had a huge volume down at Grady, and that was fun, and doing all the teaching, and I did a lot of the research of the Department of Surgery. Probably for many years, 80% of the publications were mine, and another percent were Pete Simbas, who spent all of his time at Grady in cardiac surgery and lung surgery. And it was that way until Dean Warren came to be chairman of the Department of Surgery, and then my percent dropped from 80 to about 70%, and his was about 20%. But I enjoyed teaching, I enjoyed research, and I enjoyed taking care of people, and I wasn't interested in sending bills. I guess I'm partly a socialist there. And as far as being a member of the clinic, yeah, that was when I finished my residency at Grady, 62. Okay. And I left in 84, 85. Dick Amerson and my father-in-law, Dr. Martin. And as far as surgery was concerned, those two. And then as far as people that were not in surgery, Willis Hurst. But I didn't have a whole lot of contact with the others in the clinic, in the specialty, because they'd refer within themselves there, and I never saw their patients. I had contact almost never, unless it was something like a patient with pancreatitis who was dying or something like that. Well, I don't remember any unique stories in any way that was so special, because I had very little contact with them when I was in training. I was trained at Grady, and they never come down to Grady. I had no contact with them. As far as one late member, I thought he was a founder, but apparently not, Ed Fincher, neurosurgeon. He was a great character. And he taught but he was not a member of the clinic then when I was in medical school. I remember crazy stories about him. For example, this was before they had all this equipment. They could drill burr holes in the skull and saw and remove big plates of skull and things like this, because going into a skull you'd be many hours, and getting out you'd be many hours, because there was all these hand instruments and it took quite a while. And I never forget, as a medical student, that I was assigned to his service, and the resident was out of town for some reason. So I was first assisting him on a case, and they needed another body there. So they got one of my classmates. Actually, he and I were, in our particular group of 7, it went down Shulman, Smith, Stapp, Stone, and there's Lee Stapp. So we were right all the way together in the last 2 years. And so we were scrubbing on this long process of a craniotomy, and we'd been there about 3 or 4 hours, and my back was to the window, and Lee faced the window, and Dr. Fincher was between us. And after a while, Lee kept looking out the window. And Dr. Fincher noticed this and was a little bit excited. Says, "Boy, you pay attention here. This is why you're here, to see what's going on, to see this pathology. This is why you," "Oh, yes, sir, yes, sir." Well, that worked for about an hour. And then Lee's gaze went out and started looking out the window again. And this when operating rooms had windows to the outside. Dr. Fincher caught him again, gave him a really hefty beratement. And Lee said, "Oh, yes, sir, I apologize. It won't happen again." And finally, that was good for about an hour and a half. But finally, Lee was looking out the window again, not paying much attention. In exasperation, Dr. Fincher put his instruments down and looked at him, and he just gave him hell and forever about not paying attention. He said, "Boy, quit looking out that window. Do you realize those trees will still be there when we're through?" And Lee, before he could catch him, says, "Yes, sir, but will the leaves?" Well, Dr. Fincher convulsed with laughter. I mean, little stories like that. And he was such a unique man. And I thoroughly enjoyed him. And those that rotated with him adored him. But other people scared to death of him because they didn't know him. They didn't know the other side of Dr. Fincher. And there are other stories I don't dare tell. Well, I may be in error here, I'm not certain, but initially it was the Emory University Clinic. But then, if it was the Emory University Clinic, then the university was going to have greater control over the clinic. And then that could sort out some of these problems with funding efforts in other areas, such as other hospitals like Grady Hospital. I mean, Grady Hospital was 1,000 beds, and Emory was something like 200 beds. The VA, something like 150 beds. This was a part of the overall problem that was faced. Well, then they said that the clinic said, "Well, we just won't be a university anymore. We'll just call ourselves Emory Clinic," and then set themselves separate. And then they didn't have to attend to whatever the university would so dictate. That then brought the clinic out from under the university. But then later on, then they came back under the university in a way, because they had a vice president in charge of health affairs for the university. And that would be somebody over Emory Hospital, over the clinic and the like. Eggleston maintained its separation for quite a while. but eventually came under the clinic. Crawford Long was a private hospital, and the Glenn family sort of owned it. And then when the heiress died, she willed it to the university. The medical director for Crawford W. Long was Wadley Glenn, who had trained at Grady. He was a surgeon and was there. And that, but in her will, it was willed to the university. And so that was another medical facility that would come under the authority of the vice president in charge of health affairs. No, only the nurse that Dr. Martin had, Ms. Annis, and that when he joined the clinic, she came, and that he took a half a day a week off to spend time with his grandchildren, my children, and that was when I could use the office to see patients. And Ms. Addis was the nurse there, and she was very nice and very wonderful. But she's essentially the only nurse I really recall much about as far as being in the clinic. But Ms. Addis was just wonderful. And so was Ms. Clark until Ms. Clark retired. Nothing really other than progress that was made in other universities, other schools, and then it was sort of a me too, a follow-up, nothing unique except for Winters-Hurst recruiting Grunzig to come and do the balloon angioplasty of blood vessels and then later put in stents. And that was the one item that really revolutionized so much, and it was a huge contribution. It did dramatically reduce the number of cases of open heart surgery because to do the bypass grafts, they didn't need to do them anymore. They had a way to do them without open surgery. And secondly, there was the work of Waldo Powell in mammography, doing some of the foundation work for mammography. Well, they set up the burn unit and the way of skin grafting for burns. The idea from J.C. Tanner, a guy practiced in town, but I perfected it, and it's now standard. Certain antibiotics, ran all these antibiotic studies, and they're standard antibiotics. I did the initial work on prophylactic antibiotics and showed how they had to be used and when and timed and that sort of thing, because nobody understood it. There are a lot of things we did down at Grady Hospital, and that, but then when you publish, you'd say from the Department of Surgery at Emory University, although it was done at Grady Hospital. I consider myself one of the luckiest people that's ever lived. I was born in a great time. I had parents who tolerated my indiscretions in school because I had good grades and fostered my education. And I married a wonderful girl who was not interested in any society or anything like that. She just wanted a home and children, and she didn't want to go to the most expensive dress shop. We wanted our children to go to public school. She had nothing, and I was so fortunate. Fortunate in my children. They each have a graduate degree. My oldest has his PhD, my middle one an MD, and my youngest an MBA, and they've been wonderful. And I came along as far as medicine was concerned when it was beginning to look at disease and treatment scientifically and scientifically organized studies and that sort of thing. Scrubbed on the first open heart ever done at Hopkins. Disaster. Helped run the pump on the first successful one. I met people who were very unique, such as Dr. Blaylock, who started heart surgery. Tom Starzl and I were at Hopkins together. We weren't offered another job the next year. So happened that Jim doing a lot of others, and the ones they kept turned out to be nothings, but the ones they cut turned out to be very good. We called ourselves colloquially the Cut Club. We were cut from the program. So I met all these people and in my lifetime, and I've seen all these developments, and I was able to participate in clinical research that bore great fruits as far as the way we practice surgery and do things, new innovations. And it was wonderful to be a part of that and see it develop. And then to participate in the training of certain people. And my fellows that I had have all done extraordinarily well. They're chairmen, chiefs of things, and I've just been so very, very fortunate. And I never was that interested in money. I invested from my income into TIAA and CREF for retirement. And my wife inherited some stock early and never was touched, and it then ballooned out, Coca-Cola stock and the like, so that everything is essentially gone my way. And then I left the University of Maryland because they wanted me to leave and I wanted to leave. And I ended up being chief of surgery for the University of Arizona and the Phoenix campus and developed that program there, and I enjoyed that. So I've had so many things to go well, and I've had such a wonderful life for which I'm very thankful for. And I did the most important thing of all. I married well. And for somebody is a real wonderful person. I kiddingly say I courted her on the basis of my father's advice. He said, if you meet a girl you think you might want to marry her, she has to pass the 3 tests. And I said, what test? He said, first, meet a mother. She's going to be like a mother in about 25 years. Well, Miss Martin was a wonderful lady. She was great, fantastic. Secondly, is you call on her at 2 a.m. in the morning. And Jean came to the door, and her hair was all in a rat's nest, a grubby old bathrobe, and flip-flops on, and no makeup, nothing. And she walked toward the door. She was the most beautiful creature I'd ever seen, my wife. He said if she passes that, that's the second test. Thirdly, then, if she's civil to you at that ungodly hour, then that's the third test. And now, provided each of you has a good dental certificate, you can get married. Because one of the major challenges is wisdom teeth to young couples. So I lucked out. Did things according to my father.